Hello and welcome. I'm Eric Leckey, former Associate Administrator for Mission Support at FEMA, and I'm honored to help lead Homeland Security Today's efforts for this year's National Preparedness Month. Each September, we shine a light on the critical importance of readiness across all sectors that safeguard our nation. Today, I'm sitting down with Shelly Schwedhelm, Executive Director of the National Special Pathogens System, NSPS, to talk about one of the most pressing challenges facing hospitals, preparing for high-consequence infectious diseases while balancing everyday patient care demands. This National Preparedness Month, NETEC, the National Emergency Special Pathogens Training and Education Center, has released the NSPS Level 2 Resource Guide. It's a practical playbook for hospitals that they can use right now to strengthen isolation, laboratory processes, waste management, and staff safety. These tools not only improve operational readiness, but also help hospitals increase cost efficiency and resilience. Shelly, thanks for joining us today. Let's start off. Can you start by giving us an overview of the NSPS Level 2 Resource Guide and why NETEC created it?
Sure, Eric, and super excited to be here with you today and certainly to celebrate National Preparedness Month. So it might be best for me to start quickly with what is the National Special Pathogens System. So it's a tiered structure, 4 levels, similar to trauma and burn. Those might be easily recognized national systems, but this one is particularly focused on caring for patients with a high consequence infectious disease, like Ebola, Middle Eastern respiratory syndrome, loss of fever, things like that, that have limited countermeasures and cause quite a bit of concern just from the standpoint of how quickly folks can change in their clinical scenario. With the speed of travel, we have to be ready. So the Level 2 Resource Guide has been put together. It's got 11 domains, so laboratory, personnel, training, exercises, personal protective equipment. So it walks you through each domain. It gives you very easy to use resources that are linked so that you aren't starting fresh or new as a Level 2 facility. It just really helps you to be able to navigate how to operationalize those capabilities and advance your readiness in your health system. So a Level 2 is somebody who needs to be able to care for patients for the duration of their illness. But if needed, they could always transfer them to a Level 1, which is the regional treatment center structure, of which there are 13 nationally. So we're hoping to really get to build out more fully the Level 2 positions across the country here in the next few months. So stay tuned on that. But we believe this guide will really help them be better prepared.
Well, Shelly, that's a great tool to add to the toolbox already in place. Thanks for explaining it. What are the practical tools, or what practical tools does the new NSPS Level 2 Resource Guide provide that hospitals can implement right away?
Sure. It might help you to think about how do you stand up an isolation space? Like, what should your workflow look like? It would help you to be able to identify what personal protective equipment items would be useful for what types of pathogens. And then what is your donning or putting on and doffing order for taking off? We also have a nice template in there to utilize to really cost out for your organizational leadership what it would cost to be better prepared. So we know that a special pathogen can show up anywhere at any time, given travel and the speed of that. So every health system really needs to be prepared to quickly identify, isolate, and then inform your public health folks and others who need to know so that we can quickly reduce the spread, right? It's all about, saving lives, getting them quick care, but also reducing the spread of whatever that pathogen is.
Great. And how can the guide help hospitals balance everyday patient care demands with the need for preparedness and staff safety?
Sure. With that early recognition that I just noted, that really helps correct to be able to safeguard our workforce, to keep, if everybody knows what we do, how we do it, it protects your workforce. It also protects your community. Because what we don't want to have happen is for patients to not be identified quickly and the care be provided that they need and the mitigation of transmission of that pathogen beyond that health system. We also, with the costing information, have really worked hard to make these the minimum requirements that you need and give you really helpful suggestions in that resource guide for how to reduce costs and advance readiness at the same time.
Great, thank you. What are some examples of hospitals already using this guide, and what results have they seen thus far?
Sure. So this is a brand new guide. So we don't have a lot of experience with it yet, but it was developed by our work groups, which are made up of all those 13 region level 1 regional treatment centers. So we've all learned all of these lessons ourselves and then really matched them up with the minimum capabilities for those level 2s to provide those to these folks who are either going to seek level 2 designation or who currently still have their hand up and are still functioning as a level 2 currently in the nation.
Great.
There aren't a lot of them, but we need a lot more to be able to
Absolutely.
achieve our
Absolutely.
goals.
And hopefully this interview will help spread that word. Shelly, one last question. How does this resource improve both cost efficiency and long-term resilience for healthcare systems?
I think it's fair to say anytime we know what to do, we can save lives, most importantly, but also be able to save expenses. If, again, we're not able to quickly identify, to isolate them, to inform the people who need to be informed, we're going to end up having that individual travel through the hospital, maybe back into the community, and then that's going to add costs and really cause concern for other lives. So the better, capable we are, the better prepared we are, always is the best decision and in the best interest of everyone that we serve.
Great. Well, listen, Shelly, thanks so much for taking time to sit down with us this National Preparedness Month. Thank you so much for your service and what you've done to highlight this effort and this guide here today.
Thanks for having me.